1997. It was the year Bangladesh crossed the threshold of 25 years. The year the elusive ICC cricket trophy came home, opening the doors to the World Cup. Also opening doors at this time were static primary health facilities funded by USAID. It was a time of great change. For the first time, service delivery looked to static facilities instead of door-to-door visits by health workers. Equipped to provide high-quality mother and child health and family planning services to underserved communities, the facilities would come to be known as Surjer Hashi clinics. Mrs. Hassan clearly remembers the time when she had been seated in the same chair and when she had given birth to her daughter Meeta in the same clinic. She can hardly believe that 20 years later, her daughter was about to give birth. It's not only Meeta, much else has changed in 20 years. Bangladesh's GDP is 5 times greater. Middle income status is imminent. Electricity has lit up the rural countryside. Thousands of community clinics have elevated the percentage of facility births from 4% to over 50%.
Bangladesh economy has tremendously grown over the past decade, which has brought with it changes to the country's health service landscape too. There is a now robust private health sector in addition to a growing public health sector. USAID's health strategic objective also have changed in response to Bangladesh economic success. Surjer Hashi network is a great example of USAID's transition away from subsidized service delivery to a catalyzed, sustainable financing model that ensure quality health service to those who need it.
In 2017, AUHC took over, focusing on setting up an enterprise, improving quality of care, and ensuring financial sustainability, all while safeguarding program outputs.
Setting up a centralized social enterprise was uncharted territory. And if that enterprise had to deal with close to 400 clinics that were collectively losing money, there was no playbook. So AUHC had to repeatedly take on new goals and pivoted to new roles.
As free and accessible healthcare reached rural people's doorsteps, demand for Surjer Hashi's services declined. This impacted the sustainability goals of Surjer Hashi.
AUHC helped SHN optimize the network size by phasing out underutilized clinics. Clinics were made leaner and more efficient. Many facilities underwent renovations, relocations, restocking, and recruitment drives.
AUHC also invested in health informatics for SHN that support SHN's capacity to access real-time data for strategic decision-making. The Electronic Medical Records or EMR-based health information system is based on DHIS2 platform that allows interoperability with the government data system. Surjer Hashi network has been reinvented, so to speak, with significant urban footprint. Its business model has been reinvigorated. That has placed this network on solid pathways for financial sustainability and improved health impact.
What has remained constant through this transformation is this clinic's essential, family-oriented, and empathetic character.
In this fast-paced world, this is not enough just to introduce the service, even though there is a demand. It's important to understand the customer pain points. So what we are trying to do in the segment where we are catering to lower to lower middle income group, we are trying to understand their unmet needs, and in many cases it has been the compromise service. So in addition to affordability, we are trying to give them delightful customer experience and quality. In this journey, Surjer Hashi Network and AUHC's technical teams have worked together. They have built tools, policy guidelines, and training manuals, and these have been very helpful to build the capacity of the clinic-based teams. We're really happy that in the recent months, cost recovery has grown to around 80%, and this is fully driven by revenue growth. We have started to receive funding from Bangladesh government, from the Health Ministry, which is another milestone. The day is not far when Surjer Hashi network will be fully sustainable.